Okay, let's unpack this a bit. Imagine you're just petting your cat, like normal, and suddenly you feel a swelling, maybe somewhere that seemed perfectly fine yesterday. It can be quite alarming.
Mm-hmm.
So today we're doing a deep dive based on some info we've got here, looking into a specific thing called feline mammary gland hyperplasia,
Right.
which basically is a non-cancerous enlargement of one or more of a cat's mammary glands.
Yeah, sounds a bit technical, but it's essentially that swelling in the mammary area.
Exactly. And we've got some detailed medical background here, and our aim really is to give you a clearer picture of this condition, like what might cause it, how vets diagnose it, what the treatments look like so you feel a bit more prepared.
Absolutely. And what's interesting right off the bat, I think, is that while you might immediately think, oh, swollen mammary glands, maybe she's pregnant,
Mm.
it's actually, well, it could be more complicated than that.
Ah,
The information suggests it's most common in younger female cats that haven't been spayed queens. They're often called, especially when they're in heat, cycling, or actually pregnant. That fits the pregnancy idea, sort
well,
of.
yeah, that makes sense. Pregnancy hormones kicking in. But here's a twist I found surprising. The info also says this can happen in cats of either sex, even after they've been spayed or neutered.
That is interesting. It's apparently quite rare in males, thankfully.
Yeah, but still,
Hmm.
possible. And something the sources really stress is a link to certain hormone treatments. They specifically mention exogenous progestogens, stuff like megestrol acetate.
Right. So if your cat's on any hormone medication, that's definitely something to flag,
Yeah,
a key connection.
absolutely.
And tying it together, it really seems like hormones are the common thread, wouldn't you say? Although, interestingly, the sources also mention it seems less common in older pregnant queens, maybe those around 9 to 12 years old.
Huh. So maybe their hormonal response changes as they age.
Could be, yeah. Something changes.
So, okay, what are the actual signs then? If you're an owner, what should you be looking for?
Well, the main thing described is a pretty rapid enlargement swelling of one or more of those mammary glands. And rapid means like over maybe 2 to 5 weeks.
2 to 5 weeks. Wow, that's quick.
It is, yeah. Noticeable. And importantly, in straightforward cases, these swollen areas usually feel quite firm, but they shouldn't be painful to the touch.
Okay, so firm, fast growing, but not painful. That's a key distinction. What about the cat overall? Do they seem sick?
Usually not, at least not initially. The sources say there aren't typically signs of general illness at first, but, and this is important, if complications pop up, then you might see other things like a faster heart rate, tachycardia,
Hmm.
or the cat might become lethargic, lose their appetite, anorexia.
I see. So it starts local, but could become systemic if things go wrong.
Precisely.
Okay, let's dig into the why then. We keep saying hormones, but what's actually happening on a biological level?
Right. So the information points to what's called an exaggerated proliferation, fancy term for overgrowth, basically.
Okay.
The mammary tissue overgrows because it's responding really strongly to high levels of progesterone.
Progesterone, the pregnancy hormone, essentially.
Yes, it's high during pregnancy, but also during false pregnancy,
Mm.
or crucially, if the cat is getting those external hormone drugs, the exogenous progestogens we mentioned.
Ah, okay. So it's the body's normal response just going into overdrive somehow.
Exactly. It's often an exaggerated version of a normal biological process, not
Yeah.
some completely alien thing.
Makes sense. But what about those spayed and neutered cats? If they don't have ovaries or tests producing hormones, how does that work? That seems odd.
Yeah, that's the tricky one, isn't it? The sources bring up a couple of possibilities here. For cats that have had that surgery, gonadectomy, developing this might point towards something called ovarian remnant syndrome,
Ovarian remnant, meaning.
meaning a tiny piece of ovary might have accidentally been left behind during this phase surgery. And even a small piece can sometimes keep producing hormones.
Wow, okay. Didn't know that was a thing.
It is. And beyond that, the sources also suggest other hormones might be involved in these post-surgery cases, things like growth hormone, prolactin, maybe even insulin-like growth factors. It gets a bit more complex when the main hormone factors are gone.
Fascinating. So diagnosis then. How does a vet figure out if it is this hyperplasia and not, well, something else? What's the process?
Yeah, ruling things out is step one. A big one to differentiate is mastitis, that's an infection in the glands.
Right. Infection versus just overgrowth. How do they tell?
Key differences the sources highlight. Mastitis is usually in nursing cats, The glands are often red, hot, and definitely painful. Plus, the cat usually feels sick fever, lethargy.
Okay, so pain, redness, fever points more towards infection.
Exactly. And if you were to get a fluid sample from a gland with mastitis, you'd typically find inflammatory cells, bacteria, signs of infection under the microscope.
Got it. What about the other big worry cancer, mammary neoplasia?
Yes, that's a major concern, especially in older cats, say over 6 years old. The sources say it can sometimes feel similar just on examination.
So how do they differentiate?
Cancerous masses might feel more irregular, maybe less clearly defined. Ultrasound can also show differences in the tissue structure, but really the only way to know for sure if it's cancer is a biopsy, taking a tissue sample.
A biopsy, right. That makes sense for a definitive answer. Does routine blood work help at all?
Often, not much with uncomplicated hyperplasia, according to the sources. Blood tests and urine tests might look pretty normal. Unless there's a secondary infection, like that mastitis we talked about, then you might see a high white blood cell count, sign of infection.
Okay. Can they test hormone levels directly? Like that progesterone?
Yes, definitely. Measuring progesterone can be really useful. High levels confirm that hormone exposure, or in a spayed cat, it strongly suggests that ovarian remnant possibility. They'd also likely use ultrasound, maybe rule out pregnancy first, but also to look at the glands themselves. With hyperplasia, they often see quite uniform, homogeneous tissue, maybe with round, well-defined masses inside.
And what if there's like fluid or discharge from the nipple? Can they test that?
They can. A cytologic exam looking at the cells in the fluid. With simple hyperplasia, the sources say you typically wouldn't see signs of inflammation in that fluid.
Okay.
But again, the gold standard, the most definitive diagnosis, comes from that excision biopsy we mentioned. Sending the tissue to a lab confirms it's benign fibroglandular growth without inflammation or tissue death.
Right. A thorough process. So, okay, let's say the diagnosis is confirmed, feline mammary gland hyperplasia. What happens next? What are the treatments?
It really hinges on the cause. So, if it popped up because of a pregnancy or a false pregnancy, the good news is it often just resolves by itself as the hormone levels drop back down naturally.
Oh, okay. So sometimes it's just wait and see.
Pretty much.
Right.
Though if the owner isn't planning on breeding the cat, the vet might recommend spaying her to prevent it happening again with future cycles.
Makes sense. What if it was caused by those hormone medications?
Simpler, in a way. The main treatment is just stopping the medication. The hyperplasia should then regress on its own over time.
And for those spayed or neutered cats where they suspect an ovarian remnant?
Then the treatment is usually surgery again, this time to find and remove that leftover ovarian tissue.
Okay. Are there things they can do just to make the cat more comfortable while it's resolving, or if surgery isn't immediate? Any medications?
Yes, there are some options mentioned for managing it. Things like progesterone receptor blockers, aglepristone is one they mentioned, which block progesterone's effects. There are also prolactin inhibitors like bromocriptine or cabergoline. Even testosterone has apparently been used sometimes.
Are these common? Easy to get?
Well, that's the catch. The forces note that some aren't specifically approved for cats. Availability might vary, and they can have side effects. Nausea is mentioned, and aglepristone would cause abortion in a pregnant animal, so that's critical. Also, injection site reactions, maybe vomiting with others. So definitely a careful discussion with the vet about risks and benefits.
Right, not something to try without vet supervision. What if things get really bad? Complications.
Yeah, if there are complications, like that secondary mastitis, or the glands are huge and causing problems, or if the tissue gets damaged, then more might be needed. That could mean surgery to remove the affected gland or glands and mastectomy, plus antibiotics for infection and general supportive care, fluids, pain relief, whatever the cat needs.
Okay, a range of approaches depending on the situation. So, looking at the bigger picture, what's a prognosis? What's the likely outcome?
Generally quite good, actually. The sources are reassuring here. They say remission, the swelling going down, is likely within about 4 weeks after you deal with the underlying cause.
4 weeks? That's pretty quick recovery, relatively speaking.
Yeah, once you stop the progestins or the pregnancy or false pregnancy ends, or the remnant is removed, or they use that aglepristone treatment, it tends to resolve fairly predictably.
That's really good to hear, but could it happen again? Especially in a cat that isn't spayed?
That's a bit of an unknown, unfortunately. The sources say the recurrence risk in intact females isn't really well documented. Same for whether this condition is linked to other reproductive problems, it's just not clear.
So still some questions there.
Definitely. It suggests maybe keeping a closer eye on the reproductive health of cats who've had this, maybe considering spaying more strongly.
Okay, so let's try and sum this up for everyone listening. Feline mammary gland hyperplasia, it sounds scary, but it's often a benign, non-cancerous thing tightly linked to hormones.
Right. Hormones from pregnancy, false pregnancy, medications, or even sometimes leftover tissue after a spay.
And figuring out which cause is key, and that involves ruling out infection like mastitis, and the big one, cancer, often needing tests like ultrasound or even biopsy.
hmm And treatment follows the cause, stopping meds, waiting for hormones to settle, or sometimes surgery. But the outlook is generally positive once the trigger is addressed.
Absolutely. And the clear message, as always, really, is if you notice any change like this in your cat, any swelling, lumps, especially if they appear quickly.
Get them checked out by your vet. Straight away. Don't guess, don't wait. They're the ones who can properly diagnose and guide the treatment.
Couldn't agree more. And maybe a final thought to leave you with. Considering how clearly hormones drive this condition, it makes you wonder, doesn't it? What other, maybe seemingly unrelated health issues in cats might have these kinds of underlying hormonal connections that we're still figuring out?
That's a great point. The body systems are so interconnected, there's probably still a lot to learn about those links in veterinary medicine.
Definitely something to think about. Thanks for digging into this with us today.